Hi, Hollie-Ann. Good to catch up.
Hi, Mary.
We had the privilege of doing a collaboration over the last couple of years. 2020 was the year it began.
I know.
So yeah, Hollie-Ann, speech pathologist, who undertook the research with MYO Munchee Newcastle University collaboration. Thank you for picking up the mantle of taking that on. We really appreciate it. And I guess I just wanted to have a little bit of a conversation around how important you think it's been in speech pathology, because that's something that was really important to me. There's a couple of things that I wanted to do with the funding. I wanted to fund in the speech pathology department because I thought it's a great opportunity to work with the speech pathologists, because I feel like the MYO Munchee is such a useful tool, and I know that they're always looking for, can you give us a little bit more research? Can you tell us a little bit more about whether it's evidence-based? And so we kind of wanted to just get a little bit more information around that. So that was a big part of it. And Newcastle, I really wanted to do something local as well. We're a Newcastle company, so we were really excited to work with Newcastle Uni. So just a quick snapshot from your perspective of someone who came in from the outside and didn't really know anything about MYO Munchee, or really about orofacial myofunctional therapy even.
Yeah.
3.5 years later, what do you think? And as an educator in the Newcastle University, is there a bit of a buzz around? Is there a bit more interest in that sort of sphere?
Yeah, I think, look, definitely. First of all, I guess what I'd like to say is thank you for choosing University of Newcastle and taking a chance of me, especially when I said, Mary, just trust me and go with it. I know that quite a lot of your experience had been, you know, in a paediatric space, but when I started reading the information, because, you know, I didn't have very much knowledge, if any at all, about OMT or devices, when I started reading up on this area, I went, oh, there's so much potential for this. And I think I'd said to you a couple of times, I feel like I could fall down a rabbit hole. There were so many different ways that I think that my research could have gone or could have taken me. And it was only that, you know, I'm a very adult-based acute clinician that I really had that focus. So I think, first of all, you know, thank you to Munchee for trusting, you know, my experience as a speech pathologist to take you on a little bit of a journey with me, and also the journey that I jumped in the roller coaster, strapped myself in, and I had no idea what was going to be at the other end. So I think from that point of view, it was really interesting and engaging for me, because I didn't know about that space, and it was really lovely to learn that there was something else out there that could complement what I already did, and that there was, you know, a device that might be a transitional tool that would complement my therapy, or would set my patients up so that they could have better outcomes for oral care, for example, because that's a particular interest. And if that means that it can reduce the risk of aspiration in my patients and keep them out of hospital and give them better quality of life, then that's, you know, that's a bonus for me to have those outcomes for them. So I guess from a speech pathologist point of view, who didn't know much about it, I loved the ride. It's a ride that I'd still like to stay on, and I think that it's generating more interest amongst speech pathologists who are saying, hey, what is this? And should I know more about it? And hey, I really would like to know more about it. How do I do that?
Fantastic. That's exactly what we wanted to do. We wanted to get exactly that, that curiosity, that interest, and a little bit of foundational information to make them feel a little bit more confident in the journey. So thank you very much.
My absolute pleasure. Thank you.